Hi guys, welcome to Social Connections with Modesh. Today's session is a very important one and wait a minute, we have Dr. Aprajita with us. I'll just take her on the video. Hi Anahita, hi Akshit, hi Mahima, hi
Hi,
Apra, how
Karishma.
are you?
Oh, good. Happy to be here. Excited.
It's so good and first of all I'd like to thank you for joining us today for the session.
Oh, it's my pleasure. Thank you for the opportunity.
All right, for all of you who don't know, we are a family of doctors, and Aprachita is my cousin. She is a psychiatrist. And recently, I personally had a very weird experience. I was having a very good quarantine. I personally didn't feel anything was going wrong. I was not isolated at all. I have a big family, and I have two small kids, and I've been keeping really busy with them. So I got a major anxiety and panic attack, and that's when I contacted Aprajita, and she really helped me cope up with it. So that's when I decided to come up with this session so that, if we can help even one of you cope up with the anxiety and the stress related to COVID-19, it'll be like a good thing for us. So, beginning the session, Aprajita, do you think COVID is actually causing any kind of stress into the lives of people? Do you think it is affecting people?
Absolutely. These are unprecedented times, Karishma. The COVID pandemic started out as a physical health pandemic, but over the course of the last few weeks to months, it has almost become a mental health pandemic as well. If you look at the new statistics from the UK and the US, I should look up more about India as well, but the UK, that 49% of people above the age of 16 are living with anxiety and mental health problems during this. In the US, especially with what's going on, the rates are higher, about 70%.
Okay.
So the point is that we're rightly talking about mental health. We're rightly talking about physical health problems right now. There's so much happening. But why can't we also talk about mental health problems? I mean,
Exactly.
if you're feeling positive and your mental health is good, it boosts you.
Apra, I think your voice is, we are losing your voice a little bit in between. So try to speak a little slowly so that we don't lose on any information.
I am a fast talker.
Yeah.
Can you hear me?
Yeah, your voice
Can you
is
hear me
breaking a
better?
little bit. I've been getting messages and even I felt it. Yeah.
Oh, I'm going to hold up the phone a little
It's
bit.
okay. It
Is
get
it a bit?
better with time. That's what my experience tells. It keeps getting better. So that's fine. You can carry on. Just speak a little slowly.
So getting back, as a psychiatrist, we've been seeing increasing levels of anxiety over a relatively short period. And as important as it is to look after your physical well-being, it is also important to talk about your mental health. And I have to say, this isn't something unique to the COVID-19 pandemic. When there was an Ebola outbreak in Sierra Leone, or after the H1N1 outbreak in 2009, at that time also, once the physical health problems passed, we did see a lot of people complaining about mental health problems. So yes, it's absolutely something we need to talk about. Mental health matters.
Yeah. So, do you think in India, people are still reluctant to speak openly about mental health, and psychiatrist is something they cannot easily relate to?
Oh, absolutely. I'd agree with you completely. And I think the biggest problem is the baggage of stigma which comes with mental illnesses. We as a society tend to discriminate against people and stereotype those with mental illnesses as, say, calling them violent, calling them untrustworthy, they're not responsible, can be contagious. And the one I absolutely hate the most, that you can only have mental illness when you're weak, when you're weak-minded. So all of this sort of, when someone's struggling with mental health problems, all this perception around them leads to a feeling of self-doubt and shame. They become isolated, they don't seek help, and then it snowballs, starts affecting your social life, your occupational life. So, why not just nip it in the bud? And compare it to, let's say, a physical health illness. If you get diabetes, your entire family will rally around. They'll monitor your diet, they take you to the doctor. So why do we think anxiety and depression are just going to go away on their own? You need the support of your loved ones. Sometimes you need the support of mental health professionals. But it's slowly changing, Karishma. I mean, initially when I started out, it used to be families forcing and bringing in those really mentally ill people to the outpatient department. But in my last few years, I've seen a lot of college students, a lot of people who work in the corporate sector, a lot of homemakers. And if there's anything this pandemic taught me is that homemakers have more stress than any of us. It's changing.
Exactly.
So does that make sense about why there's reluctance to talk about mental illness?
Yes, I get your point. So, is it mainly because homemakers are suffering from it?
No, I mean, in general, mental illness, to be honest, is the prevalence is a lot more than we know about. Like, for example, in India, a recent study shows there are 150 million people who require support from the mental health services. Actually, I mean, and about 70 to 90% actually never visit a professional or get this that much back.
I'm sorry, I'm losing you again. Can you repeat? Can you come back again?
Okay, I was just saying that in India, there are about 150 million people who require mental health care, and 70 to 90% of them actually never seek the support that they require. So there's a lot of gap that needs to be bridged, and it's not. And over the last few years, I've seen people who aren't really, really mentally ill, but also people who are suffering with moderate levels of anxiety, depression, which is a lot of college students, it's homemakers, it's people working in the corporate sector. So it's been affecting all of us. It's only now that we're starting to talk a little more about it.
Yeah, because I used to feel that I'm mentally very strong. So I consider myself mentally very strong. And so I'm not sure if it was like totally an anxiety attack, but when I discussed it with you and you also told me it seemed like it. So that's when I decided that, if I am feeling that way and I feel I'm one of the blessed people, I'm not staying alone, I'm not isolated, I have so many people around me, I barely have time. So that's when I thought that, your help is needed on a bigger platform. And, let's just come to the main question. What do you think are the symptoms and what are the signs of anxiety and panic?
Okay. Karishma, before we get into the signs and symptoms of anxiety, I think it's very important to talk about what's normal anxiety and what is too much anxiety. Now, these are confusing and stressful times, and we're still learning so much about the coronavirus. And it is this uncertainty and the fear of the unknown which is driving a lot of the anxiety that people have. And I will say this repeatedly, but some amount of anxiety is clearly warranted times.
Sorry. Some amount of anxiety is?
Some amount of anxiety is clearly warranted. It is almost a normal response to feel anxious to some extent. For example, now if you have an exam, you need that anxiety to motivate you and push you to study.
Exactly.
You have an exam, I'm going to take a nap. You're going to say, no, I'm going to study, I'm going to focus. And anxiety drives you to perform better. The same way, this anxiety about the coronavirus is keeping you safe. Because you're anxious, you're practicing social distancing. Because you're anxious, you're following good hand hygiene. You're making sure you're safe, your loved ones are safe, and you're keeping the community safe. So that anxiety is required. But now the question comes, when is that anxiety normal, and when does that anxiety become problematic? So as I said, so normal anxiety is motivating and it's helpful. But then when this anxiety starts giving you subjectively, starts distressing you, and it starts affecting your occupation, your social life, your occupation life, that's when it is a problem. And what happens, starts manifesting both physically and psychologically. So physically, you may have symptoms like what you have at that point.
Sorry, please come back again. We lost you again a little bit. Sorry, please.
I thought my connection was better than that. So as I was saying, that when anxiety starts giving you subjective distress, and it starts affecting the spheres of your life, your patient sphere, your social sphere, that's when you know that it is excessive. Excessive anxiety manifests as physically, it will manifest as racing heart, dryness of mouth, feeling of tightness in the chest, difficulty breathing, feeling tremulous, feeling sweaty, and you can feel nauseous. That you can have that abdominal, that sinking sensation in your tummy when you go down a roller coaster. So, oh, I'm so sorry. I'm getting.
Hello? Wait a minute. Yeah, I think we've lost you there.
Is this
Yeah,
a bit better?
yeah. Now you're better. Yeah,
Okay.
can you speak now? Let's
So
see.
physically, as I was saying, it manifests in a lot of ways, like palpitation, shortness of breath, tightness of chest, nausea.
That's exactly what I was going to
Exactly.
say.
And
Yeah.
now, so those are the physical symptoms. Now, psychologically, you can feel like you're losing control, and you have this sense of impending doom that something bad is going to happen to me. And you can have experiences. You can be more irritable. You have difficulty concentrating. So the basic crux is that anxiety has a lot of manifestations. It can vary from having a panic attack, which is what you had, Karishma, which was a discrete episode of feeling intensely anxious, to the other
Right.
side where you feel sort of anxious throughout the day. That's called generalized anxiety. So it's generally a mix and match of a lot of symptoms. But if you feel like you're having difficulty relaxing, you're always feeling on the edge, then that is probably excessive.
All right, all right. So that was very well explained. And so, not all anxiety is bad anxiety. Some of it is required. And, when it reaches another level and you physically start feeling the effects of it, that's when we need to, start taking it more seriously.
Exactly.
Yeah. So, like now, can we talk about, okay, you've already covered the symptoms and what we and palpitations and feeling suffocated and stuff like that. So, coming on to the next question, what are the ways to cope up and manage this anxiety? Like, while we are all stuck here, what are the ways that you suggest during this time? What can be done?
Okay. So again, Krishna, I'd like to bring this up and how do we prevent anxiety? And then I'd like to talk about what happens when you actually are having a panic attack or you're feeling really anxious. So, when the coronavirus pandemic started, as I said, the biggest problem was the fear of the unknown, the fear of the illness. So at that point, I think the way to prevent anxiety would have been to, first thing is to always practice good self-care. It's important to eat right. It's important to sleep well. So take care of yourself a little deep. It's very important to stay connected to people you love, because sometimes talking and meditation is good enough it's almost cathartic to be able to express all the anxiety you're experiencing. So stay with people. Then I would say it's important to limit your media. At one point, there was
Sorry, you limit your
media consumption, how much
media
news
consumption. Okay.
taking in. I mean, I remember there was a point where I was incessantly reading about the coronavirus. It made me very anxious. So it's important to limit the amount of news you're taking in, limit the number of articles you're reading, and maybe just have a time period in the day where you're going to look at news instead of constantly refreshing and reading new articles. And also,
Okay.
really important to have trustworthy sources of news. You don't want to
Exactly.
you don't want to be on sites which dwell too much on the negativity and engage in fear mongering. Apart from that, exercising is very important. A healthy mind resides in a healthy body, so get moving. And I know that's easier said than done. Guilty.
Yeah.
So those are the sort of ways to prevent anxiety. But then, Karishma, what happens when you actually do get anxious, when you're having a panic attack? It's not going to all these things, you know, you've done in the past, but what do you do in the moment? So I tell a lot of my clients about something called grounding techniques and distraction techniques. Now, just to give a little background, what happens is that when you sense a little bit of, when you sense something fear, the part in your brain called the amygdala, this part sort of responds to emotions of fear. So it gets activated, and that's when it starts saying, there's an emergency, and it pushes your brain into it pushes your brain into producing all these features of anxiety, like your heart racing and tremors and sweat. And when this happens, the amygdala then thinks, oh my God, look at me, what's happening to my body? I really must be in danger. So it's a vicious cycle. It starts
All
with
right.
anxiety, and your anxiety keeps perpetuating more anxiety. So the point is to somehow break this vicious cycle. And
Okay.
The way to break the cycle is sort of to get out of your head and to distract yourself and focus on the here and now, because anxiety has a lot to do with fear of the unknown in the future. So if you can sort of focus on the here and now and focus more on your physical self, there is a chance that you might be able to calm yourself and get out of that anxious mood. So one of my favorite exercises is something called the 5 4 3 2 1 exercise. So when
Okay.
you're really anxious, the trick is to first be comfortable, close your eyes, take 3 deep breaths, count till three deep breaths through your nose, out through your mouth, feel relaxed, and then then look around you and tell yourself aloud 5 things that you can see in the room. So look around, focus on the color of a cushion or something you can see on the outside. So 5 things you can see. After that, think about 4 things you can feel. So touch your hair physically. Tell yourself this is the texture of my hair. Feel your skin, does it feel rough? Touch something in front of you. So 4 things you can feel. 3 things you can hear. So try to focus on the traffic, the birds, things you would normally not focus on. And so 5 4, then 2 things you can smell. Hopefully it'll be nothing awful, but it just activate all your senses. And last is 1 thing you can taste. So I can tell my clients that it's best to have a raisin or chocolate.
Sorry, best to?
It's best to have maybe a raisin or a piece of chocolate and put it in your mouth. Actually tell yourself how the texture of the chocolate feels, how it's melting in your mouth. So those things are important. So 5 4 3 2 1. This is one of my go-to techniques.
So then what happens? Like once the person is able to assess or not assess these 5 4 3 2 1 things, so then how do you analyze from this?
No, so the point of this is to get out of your head in that moment and focus on something else to distract yourself. So one of these techniques would be the 5 4 3 2 1. Then there are other techniques like what.
So this is what we can practice ourselves at home whenever we feel stressed or when we have anxiety.
Absolutely. And somebody wants
Smriti wants to know, can you repeat 3 2 and 1? It wasn't clear because we are losing your voice in between.
Oh, I'm so sorry. It's 5 things to see, it's 4 things to feel, 3 things to hear, 2 things to smell, and 1 thing to taste.
Okay.
And then there are a few more techniques I'll just quickly run through.
Yeah. They are very important. So
For example, then we talk about, hold something in your hand and really focus on it. For example, sometimes I use a crystal or a pebble and look at that pebble and sort of focus on the texture of the pebble, the colors in the pebble, how it's glittering, how it's shining. So, if you focus on something at that moment, you'll get out of your anxiety. Then another technique I follow is distract yourself. Try to count some things in different shades of blue in your room or different shades of green. Then there are more techniques. Of course, I'll send the links to you so the viewers can also.
Yeah, that would be really helpful.
But
yeah.
another thing is share it. Sit in a really comfortable chair, like sort of scooch your bum to the back, become really comfortable, and then focus on the texture of the chair on your skin. Feel how your arms are dangling off the chair. Then close your eyes and imagine the bad anxiety sort of draining out of your body and through your legs going into the ground. So I mean, of course, it's sounding like a whole lot of theory right now, but if you actually practice them on a daily basis, when you're actually having a panic attack, you'll be able to use these techniques, and they really help you calm down quite quickly. They help you refocus your attention from the anxiety to the here and now. So this is something I recommend. They're called grounding techniques and distraction techniques.
All right. So thank you so much. They are really, really helpful. And for all those who've missed, Akshit Shetty here has mentioned that, how do you have to run this technique on your own? And we had a question before, which I missed. Kushal Shetty is asking, how can we distinguish between medical or it's a psychiatric attack?
This is again something in our experience, actually, a lot of our referrals come from the cardiology department, because it's the minute you start having palpitations or your chest sort of hurts, you run to the cardiologist. That's our first instinct. And to be honest, I am not, as a psychiatrist and as a doctor first, I'm going to say that it's not something you should take lightly. So, I mean, if you can recognize that you're feeling really anxious at that time and you're having that chest pain and palpitations, you can maybe attribute it to anxiety. But if it is something that is happening with you often, I would recommend seeing the doctor, getting an ECG done, just making sure that there are no other causes of anxiety. Because a lot of times, some of, as Dr. Shetty herself said, a lot of times some medical things can also present as anxiety. Some people with thyroid problems, people with, you know, heart problems, mitral valve prolapses, they can also have symptoms similar to anxiety. So
All
as
right.
I'd say, if it's happening to you often, please see a doctor, rule out all the cardiac causes and some other causes like diabetes, hypertension, diabetes and hypothyroidism, and then come to a psychiatrist.
All right. So it's important to first rule out that you don't actually have a medical condition that's causing it.
Unless you feel like it's really obvious, like what you had, Karishma. You're a young person.
So I was very sure that it's not got anything to do with my medical state, but I don't know how it happened. But I had to go through all these symptoms, and I was sure it's not any medical reason. But I was internally, I knew it's the stress and the anxiety around it.
I'd agree with you. I mean, if it's really clear, you know the trigger, then, you know, just practice these techniques and seek medical help if you are in any sort of doubt.
All right. So is there anything else apart from these techniques that we can follow at home?
Yes, of course. There's something called relaxation exercises. These are called progressive muscle relaxation. There's some wonderful links on YouTube. I'll again send the links to you. These are called progressive muscle relaxation. So again, these are techniques, these are breathing techniques which help you distract yourself and get out of the anxiety. So I'd say give it a good Google. Grounding techniques, breathing techniques, and distraction techniques. These are your three go-to ones.
All right. So I have a few questions from the people here. How to deal with depersonalization and derealization?
Again, depersonalization, derealization are manifestations of anxiety. For those of you who don't know it, you know, these are as phenomena. These are phenomena where you feel as if I am out of my body. You see yourself as a third, and and derealization is as all this around me isn't real. So these are, again, I mean, these are nothing too separate from other symptoms of anxiety. So you deal with them the same way you would deal with other symptoms of anxiety. But don't get freaked out. This is not, it's these big words, but they do happen when you're feeling anxious.
All right. So could you tell the difference between an anxiety attack and a panic attack? Who wants to know?
Again, I would say that anxiety attack is a sort of, I mean, panic attack and anxiety attack are pretty much the same thing. Of course, the difference is between anxiety and panic attack. Now, anxiety is a really wide word, and it encompasses different types of anxieties, which can range from having a specific phobia about something, like how some people are scared of spiders or heights. So that's something we call specific phobia. Then there is something called generalized anxiety, which is an anxiety which you feel throughout the day. It's the kind of anxiety which comes out of the blue, and it makes you feel you feel on an edge the whole time. You have difficulty relaxing, and you can have symptoms like palpitations, tremors. So that's something which lasts you throughout the day, and these are people who tend to jump to conclusions and have a lot of what if thinking. You know, like your son doesn't come home from the park, and you're like, oh my god, he must have had an accident, something must have happened to his bike. So when you jump to those conclusions about everything, that's generalized anxiety. And then there is called a panic attack, which is a discrete period, like it'll be 5 to 10 minutes of intense anxiety where you almost feel like you're dying. You feel a sense of loss of control, sense of doom. You'll have all these physical symptoms, and it can occur without a trigger, and they generally go off spontaneously. And when you have a lot of these panic attacks, it becomes a panic disorder. So these are the different types of anxieties. Of course, sometimes you also consider obsessive compulsive disorders and anxiety disorder grossly. So I would say this is the breakdown.
Okay. All right. So Raju here wants to know, how do you help someone who is feeling anxious?
Oh,
Like
that's
being a third person.
no, that's a really good question, and that's not always the easiest thing to do. But I
Yeah.
think the important thing is to acknowledge that the person is feeling really anxious and not be dismissive of it. As the meme goes, in the history of time, nobody has calmed down by saying calm down. So same way, somebody is not going to stop feeling anxious by you saying don't be anxious. So acknowledge,
Exactly.
don't be dismissive of it, and make sure that they feel safe in the space they are in. So let them know they're supported and that you're there to listen to them and help them, and you can guide the distraction and guiding techniques. You can be the one telling the person, all right, let's focus on 5 things you can see and 4 things you can see. So you can lead all the techniques we've spoken about. But most importantly, don't brush it aside. Acknowledge somebody else's anxiety and don't be dismissive.
All right. So it's important to understand that the other person might be feeling anxious, and it's important to, just comfort them.
Yeah, and don't say it's anxiety, you'll be okay. That's not something the person wants to hear at that point.
Yeah. All right. So Kajal Malhotra here wants to know how to deal with anxiety.
Okay. Should I mean, we've been talking about it, but
Yeah.
I mean, I will also say,
Discussed a few techniques that we can follow at home.
but Karishma, I think I missed out saying something that, of course, you can follow technique, you can do preventive measures, you can follow the technique we've spoken about. But I think I also want to on the importance of seeking help when you seeking mental health professionals help when required. I mean, the general sort of, if you see enough movies and you talk to people, the general idea is that psychiatric drugs are addictive, you will become a zombie. So,
Exactly.
so the
Yeah.
important is to know that history and psychology have come a long way. We don't chain people and we don't shock them anymore. We have medications which are actually a lot of the antidepressants are actually safer than your paracetamols and your aspirins. They have fewer side effects than them, and it's about finding the right fit for yourself. If there's so many options out there now, and should you require medications, I just want to put it out there that they aren't the worst, and you just have to find the right fit. But of course, if
You
you have
made a very important point here, because I'm sure each one of us, somewhere in our hearts, are a little reluctant when it comes to taking medication. And we do feel that, these psychiatric medicines can lead to addiction. So it's a very well put point, and
no,
I think we all need to know more about this.
there is a set of medications which are addictive, but predominantly for anxiety, we use antidepressants for long-term treatment, and those are absolutely not addictive.
All right. So that's a really, that's good to know actually.
Mm.
So, how do we people? So, Anandita is asking, how do we help people who just don't want to go to a psychiatrist, as there's still a barrier in people's mind?
Oh, now I wish I knew. I mean, I'm going to try and just talk about that question, but that's a really tough one because that's something we struggle with a lot, especially in India. I mean, very
Yeah.
often I've had family members who come in, and a lot of wives will come in and say my husband's really anxious, or the other way around, but they're not ready to seek help. I think as a psychiatrist, you can't. I mean, to get better, you should want to get better, and you first have to acknowledge that you have an illness. If you're in denial, it's hard to receive help. It's hard to accept the help you're getting.
Exactly.
If you care about somebody and they're not really doing so well, instead of dragging them to a psychiatrist against their wish, I would say the first step would be to, again, I would say, make sure that the environment is safe. They feel safe enough to talk to you about their problems. Be their first anchor. Sometimes people find it difficult to talk to a psychiatrist, so you should be the first person listening to them. Try and provide them as much reading material, as many resources. Help them recognize that they have a problem, and then empower them to seek the help of a psychiatrist instead of forcing it on someone. Because if you do not want to get better, if you're in denial of your problem, you aren't going to get better. The first step is acceptance. So be that safe space for a person and provide them with resources is probably the best you can do.
So it's better not to push them to a psychiatrist. It's better to take it step by step.
Yes, absolutely.
So, like, this is personally something that I want to know. Like, whenever a patient comes to you, when do you really start giving the medication? Like, do you initially just follow other exercises and then come on to medication, or in some cases, it's like straight away you have to go for a medication?
Krishna, of course, I mean, we try to tailor the treatment to every individual, try to tailor it individually. But I think the general consensus is that when your anxiety or depression is mild to moderate, it is something which can get better with psychological input, with therapy, with exercises. So it's an option. We always tell our clients first that when it's mild to moderate, there are other ways of managing it. But when it is moderate to severe, we do sometimes recommend medications, because when your anxiety is really, really high and you're struggling a lot, you aren't going to be able to practice those distraction techniques or engage in therapy. To engage in therapy, you have to, you have to be that receiver of help and information. And if you're really anxious, you put that barrier. So grossly, I'd say mild to moderate, the option lies with the client, whether you want to try therapy, whether you want to go straight for medication, because to be honest, medication do work faster. But when it is
Exactly.
moderate to severe, I would recommend medications. As I said, they are safe, and there's so many options out there. But my bottom line would be that it is a person's autonomy, and we as doctors have to respect it. So even if your anxiety is skyrocketing and you don't want medications, I doubt you'll find somebody who'll force them on you.
All right. All right. Thank you so much. Anisha here wants to know, can online classes affect mental health of kids?
Oh, I mean, I'm
So we
glad.
have too many online classes going on here in India. I'm
Oh,
not sure if you're
oh,
aware of it, but even the little ones and all the pre-nursery and nursery kids are
mhm.
attending online classes.
Oh my God, I can't.
So how relevant do you think that is?
Um, I think the first thing is to talk to the kids about the coronavirus. Now, what I've felt is that a lot of times we're trying to protect our children and we don't talk to them about the virus. But the kids are quite perceptive. They read people's body language, they can read their parents' expressions, and they imbibe the anxiety which is in the environment. So it's important to talk to them, and it's important to do it at the right time. Then I always say that before anything, it's very important that you find out how much the child already knows about the illness. I mean, whatever they've read, whatever they've seen, even if it's a rumor, you shouldn't be dismissive, however unreal you are. And like, it's important to tell children, when you're talking to children, it has to be age appropriate.
Okay.
So, I mean, recently I had a woman who told me that when she was talking to her kids about sneezing in the crook of their arm, she would say, I tell them, behave like you're Dracula, okay? And
Okay.
make you keep up like the Dracula and then sneeze in the crook of your arm. Or when you
Yeah.
wash your hands, do it while you sing happy birthday twice. So, you have to make it age appropriate. So I think before everything, before we get to the online classes, it is important to talk to your children in an age appropriate manner about the illness. And it's important to tell them that by staying at home, they're saving a lot of lives, they're saving their own life, they're keeping the community safe, and they're saving lives of vulnerable people. So they understand why they've been locked into their houses all day. They need to feel like they're contributing. And now, coming to the
That's an important point. Yeah.
yeah, and coming to the bit about can the kids have anxiety? So absolutely they can. I mean, the corporate world, adults know it is hard to be cued into a screen all day. And we've taken so much away from children. We've taken social connections. We've taken that physical activity which releases the good chemicals.
Exactly.
Of course, they're anxious. And a lot of the educational experience of school is about camaraderie, it's about learning together, and you've suddenly taken all of that and left them with the worst part of education, which is the actual studying. So
Exactly.
I know, so of course they're anxious. And you have to, and I would say the sort of way to deal with it would be that make sure that their social connections are somewhat intact, that they're I mean, instead of letting your kid play computer games, I'd say give them time to FaceTime or WhatsApp call their friends, and maintain some semblance of reality in their life before all of this happened.
All right, all right. So that's a very valid point, because I personally, my kids are not going through that because we have so many kids at home, and so they don't really feel socially disconnected. But I can imagine the plight of kids who stay alone and how they would be feeling.
I,
Yeah. All right. So I'll just take the question, the next one. How do you deal with the Zoom meeting fatigue?
Oh my God! Yes, this question I personally feel, because I'm a doctor, and usually, my job involves interacting with people and seeing people face to face. So I never get fatigued at work. I'm obsessed with my work, and I love it. But ever since this pandemic has come in, somehow my life has also been reduced to a lot of video calls and video consultations. And Zoom fatigue is real. Video fatigue is real, because I mean, it affects you on psychological and physical. It affects you both psychologically and physically. Now, psychologically, it's the same thing as we spoke about with kids. You're deprived of real human contact. You're deprived of the camaraderie you feel in the office, and you're left with looking at a screen for hours. Now, Zoom meetings can be difficult because, when we're talking face to face, it's easy to cue into people's body language, or it's sometimes easier to ask people to not speak so much. But, sometimes people rattle on in Zoom meetings, and they can take a toll on you just sitting for so many hours. Physically, it affects your posture, it affects your eyesight. You're not taking
Exactly.
breaks, you're not walking around. So, I mean, the only sort of way to fight the Zoom fatigue is take adequate breaks as you would at work. Walk around and have do a few exercises, and sort of have time, have specific slots. Don't just stay. What I'm trying to say is, how at work we take a break. Same thing you have to do when you're sitting at home. You can't just be put into your computer all day.
So this is the overall feedback from people who are working from home, that the workload has increased tremendously. The stress of managing the house plus the work at the same time is obviously a lot. So, is there any exercise in particular that people who are working from home can perform while they are working, like anything else, like very easily that they can do, which can release a little bit of stress for them?
I mean, yoga and meditation and mindfulness, those are things I would very strongly recommend. Now, I mean, yoga is an ancient Indian thing, but of late it's finding mental health in general. We've had a lot of studies where yoga is been shown to be beneficial, not just anxiety and depression, for even severe mental illnesses like schizophrenia. Yoga has shown a lot of good effect. Then, of course, just walking around, physical, any sort of physical activity. I say dance it out, some amount of release, some adrenaline. Now, I know you can't do this in the middle of work, but take those stipulated breaks as you would at work and dance it out. Do a few jumps, release that energy. But yoga and mindfulness, I would very highly recommend.
All right. So we should not underestimate the importance of taking little breaks in between while we are working.
Absolutely, those are essential.
All right. Thank you so much for that one. Someone here is asking, would a therapeutic approach be better than a medication for anxiety?
This
Therapeutic.
Therapeutic. Oh, I mean, when we say therapeutic, it means both psychological and pharmacological. Both of them together help you to get better, and that's why both of them are therapeutic. But as I said, you are the decision maker. The autonomy of what treatment you want. I mean, the autonomy is entirely yours. But as a doctor, and as what our guidelines say, we say from mild to moderate, do what you want. Do psychology, take medications, it's your call. When it is more severe, you might not be the best candidate for psychology at that point, and would want your anxiety to drop down a little bit so that you are more amenable to the psychological help. So that's when you should maybe consider medications.
Yeah. All right. So Neha here wants to know, 8 years back, I suddenly felt panic attack like symptoms while driving. It continued then and often more for more than a year. Meditation helped me come out of this situation, but now I'm suffering from teeth clenching and jaw stiffness. Is this also related to panic attack?
Not, I would say, in my experience, not very typically, but it is not unheard of. People who have teeth grinding. That is something I have heard of before. Generally, it's more with younger children, but it's not entirely impossible that those are also anxiety. But what I say is, Karishma, that don't break down your symptoms too much. Like, don't just take the jaw clenching in isolation. If along with the jaw clenching and the teeth grinding, you are having thoughts which are anxious in nature, where you feel like you're losing control, or you feel like something bad will happen to you, and you're not able to relax, and you're not able to concentrate. So all that in conjunction would sort of be anxiety. But yes, of course, if it is something if she's experiencing that and she's able to relate it to anxiety, it is a possibility. But I think it requires a little more exploration.
All right. I hope you got your answer, Neha. I'll just come to the questions that I had for you. I wanted to know that what is the role of physical well-being on mental health well-being? So, like yoga and meditation and all, like you stressed on those points that it's important, right? Mm-hmm. So, apart from that, do you think physical well-being is like the amount of physical well-being that you have is directly proportional to the mental well-being?
Absolutely, Karishma. I cannot emphasize more. I always say healthy mind only resides in a healthy body. When you exercise, it releases a lot of good chemicals, the endorphins, which boost your mood, which relieve of stress. Exercise helps you to sleep better. And a lot of our studies also show that people who exercise are actually able to, they have better memory, they're able to focus better, and they have upper thinking. And those are just the sort of few of the psychological benefits. But of course, physically, when you're healthy, when you're fit, you have good self, that also affects your well-being. So, highly recommend.
All right. So I think I need to start doing that now.
Oh, not just you, not just you.
Because physically, I am like completely lazy. I don't do anything, and I always try to, but I think that is something that I need to inculcate in my routine now.
Oh, Karishma, the hypocrisy I just felt advocating the exercise. You know what? Today I'm going to dance it out.
So Surbhi here says, what about staycations and normalizing vacation or days off, even though you know that you can't really go out?
Oh, I think out of, this has been a terrible time for all of us, but I think there has been a little silver lining this pandemic. I think it has helped us all discover a little bit more of ourselves. And I mean, look at the banana bread pandemic we had, so I think because of this, we've discovered that we don't always need to go to a restaurant, or we don't always need to go to the movies to entertain ourselves. It is, find a hobby, find a hobby. Like a lot of people now have discovered cooking, and
yes, that's true.
So so what I think is, as Sylvie said, it is important to realize that you don't always need to go out and tour different places to feel better and have a good time. It is enjoying the company of your loved one. It is finding a new hobby, whether it be journaling or cooking, and or reading. I think this pandemic has put a few things in perspective, despite all the havoc it's caused. So I say, do not work all the time. Take a break. Your weekends are still your weekends, and just because you're not going out doesn't mean you don't deserve all the relaxation and all the entertainment.
Yeah, so we should take up activities that relax us.
Absolutely. Absolutely. I mean, I've been blown away by, the amount of baking and the cooking people are doing.
Yeah. That's actually very true. We barely get any baking stuff in the markets now because everyone is cooking and baking at home.
Yeah. I am renaming this the banana bread pandemic. There has been.
Yeah.
Yeah.
So Akshit here wants to know, do most people have mild to severe anxiety?
Actually, most people have mild anxiety. The severe anxiety is the clinical anxiety. Severe anxiety, the percentage is much lower, let's say 5 to 10%. In fact, they say anxiety is the most common mental health problem which is affecting the world, more so than even depression when you take into account all the different types of anxiety. And up to 40% people can have subsyndromal anxiety to mild anxiety, while severe anxiety is limited to only about 5%. So, you're not alone if you're feeling anxious, 40% people.
So, what is the worst that can happen if the anxiety reaches like the maximum level? Then, what is the worst that happens?
Actually, I mean, what I'd say is, Karishma, that I think it's a good question you asked. What happens is that when you have anxiety often, after a point you realize that nothing too bad can happen. Anxiety will come and anxiety will pass, and I will still survive. So it's not the worst. I mean, a lot of time for people with obsessive compulsive disorders, we tell them that thoughts will come and thoughts will go. It's only when you give them too much importance that they start being distressing. So if you're somebody who's really struggling with anxiety and you can't seek help, after a point you'll realize that your anxiety will build up, it will trouble you, but eventually it will go. Everything that goes up has to come down. So
All right.
your body is
That's good to know.
are strong. It's homeostasis. We will fight and we will find a new normal.
All right.
But
So, what's the new normal according to you?
oh, well, I think the new normal is everything we've been talking about. That you know, you're spending. New normal is working from home. New normal is being constantly surrounded by your family members. I mean, I know
Exactly.
a lot of times we talk about the isolation and the loneliness of the pandemic, but to be honest, I've had clients have spoken to me about the fact that they aren't able to get any alone time. Like before, the partners would go to work or the kids would go to school, they'd get some respite. But this pandemic has been quite different in the way that we're always in each other's space. So I think that's also
Exactly.
an important point to know, that just because you're always at home doesn't mean you can't have the space you require. So this is when it's important to have a routine. If everybody has their own routine, that they can find separate times, find some hobbies. I mean, it's important to do things collectively as a family, but it's also important to find your own have own personal sort of joys, like maybe journaling, or one person goes on a walk while other one stays in. So it's important to acknowledge that when a lot of people are together for a long period of time, the inactivity and the anxiety is going to can lead to arguments and heated discussions. So I think it's good for all of us to acknowledge that these things can happen and we shouldn't let them trouble us too much. But I digress. I forget. So we were talking about the new normal. So yeah, that's what it is. Working from home, always having family around, and hopefully coming out of this pandemic with some new skills. But if not, that's okay too. I think we should all be easy on ourselves. We're living through a pandemic. I feel like that's a chore enough.
That's very, very well put. Fire here is asking any particular kind of meditation technique that you would recommend?
Um, Now, I'm not, while I'm not an expert in meditation, but what we recommend is something called mindfulness. Mindfulness is it's a combination of it's a combination of Zen Buddhism and meditation put together, which again, it brings your mind to the here and now, and it helps you focus on what is here in the present instead of you spiraling into questions about the future, anxieties. So I would say look up mindfulness, but full disclosure, I'm not very well versed with meditation and its different types.
Yeah, that's a different industry altogether. So Anandita she's asking something. As a manager, the biggest concern for me is the well-being of my team. So what signs can I look for to maybe know if someone is stressed or anxious? I think that's a very good
That's
question.
a really good question. I mean, if you've known somebody long enough, you can notice subtle changes also. I would say that if you notice somebody being easily irritable, or if you notice them being easily irritable, getting tearful easily, or if you notice a drop in their productivity. I mean, as a manager, I'm sure it's something you do notice. If you notice a drop in their productivity, instead of pouncing on them and why they aren't doing as well, I think it's important to explore, is it because of lack of concentration? Is it because they're so anxious that they're not able to work? Because that's how a lot of times anxiety and mental illnesses work, that to a point you're able to sort of cope and manage and push yourself. But after a point, it becomes so overwhelming that you're almost sort of frozen. So as a manager, I would say watch out for signs of irritability, loss of focus, memory problems, emotional outbursts, anger outbursts, which are not in tune with their personalities before all of this happened. And as always, provide a safe space for them, a non-judgmental space for them to talk about.
So I've been having conversation with so many people after I sent out the creative for today's session, and mostly the working people have somehow I've just noticed it that they have a lot of problem with their managers, especially during this time. Everyone is really complaining about their managers. So probably that's the reason that maybe the managers are not really understanding where the employees and their workers are coming from.
No, I mean, the pressure, I suppose, goes both ways. The managers are all, it's the hierarchy, the top dog is troubling the next one in line. So I'm sure the managers are facing a lot of it too. But I think it's important to remember that these are unusual circumstances. And if we don't support each other through this, what's the point? I mean, this is not going to last forever. We are going to go back to life as it was. But during this time, it's important to support each other, because this we've, as a collective society, we've never gone through anything worse than this. So
Exactly. Because even the small little things that we were doing, it has become like a source of stress. Even going out for a walk is so stressful. Coming back, I don't feel like holding my kids because I know that I've just come from outside, and it makes me feel guilty when even I hold them. And even though I know I've taken all the necessary precautions, so little things have become so stressful. So do you think all these little things are also adding on to the stress on our minds? How to get the vegetables, how to wash them, how to what not to do with them, what to do with certain things.
No,
Do you think these little things are also adding on to the
no,
stress?
absolutely, Karishma. As I've been saying, it's the uncertainty, it's not knowing which is causing the anxiety. But
Exactly.
that's something I tell my clients a lot, that action is the antidote to anxiety. So if you can sort of figure out what are the things making you anxious, tackle them head on, make a plan of action. So you know that going to the market makes me anxious, buying grocery makes me anxious. So make a plan of action. When I come home, I will, like a drill, do exactly this, so that I don't infect my kids, instead of grappling with that anxiety on a daily basis. So there's so much in the world right now that we can't control. We don't know what's going to happen with our futures, but what we can control, we should, because it gives us a little bit of a sense of power, and it helps to calm the chaos. So action, have a plan of action, especially when you know that there are things which are triggering you often.
All right, so we have 7 minutes left now, and I have a few questions. So try answering them in a
Oh,
one
that's
line.
why it is.
Let's just try to give one line answers to all of these people.
Sorry, I do talk.
How do you tackle overthinking, which people are obviously not able to control? So the what if factor like is affecting their thinking all the time, and they're not able to control it. So how can they tackle that?
My one line answer would be, look up something called CBT. It's called cognitive behavioral therapy. It's a therapy which is, I mean, you don't even have to go to a therapist. There are lots of self-help resources out there. They help you deal with things like overthinking. They help you change the way you think and the way you process things. There's no one line answer for how to stop overthinking. It's like the same thing. I can't ask you to calm down. But look at something called CBT online, cognitive
All
behavior
right.
therapy.
CBT. All right.
CBT, C for cat.
All right. So, what are some creative therapeutic activities to take up as a hobby to calm mind?
Oh, what
Like
I
some people say pottery, like getting into
oh
pottery
yeah,
is
and
something
that
that
note,
calms your mind.
check out
Yeah,
somebody called a Clay Story. She's another one of our family, and she is absolutely
yeah.
brilliant. Now,
And she's amazing.
Andrea Kapoor follows her now. But anyway, the point is that pottery is really good. Then there are things like journaling, which will really help. Coloring, I have personally found to be extremely useful. Then baking, cooking. So I'd say some of those. But look at something called journaling, and I follow this blogger called Katie Bellot, and I'll link it up. She does some amazing work. She shows you how to journal, and it's not just about writing. It's not just writing how you feel, but it's doing it aesthetically. It's brilliant. But music and dancing.
Music, dancing. All right. Thank you. That was very helpful, Apra. Anju Suri wants to know your perspective on meditation, whether it really helps, its medical relevance.
Meditation absolutely helps, but as a doctor, I'd say you have to know what conditions meditation can help. Like for anxiety, depression, meditation works really well. But if you are somebody with more severe mental illnesses, sometimes meditation can be detrimental because you can't be left alone with your thoughts sometimes when you're having a severe mental illness, like say psychosis. So I think a sort of blanket answer would be yes, they're really good. Unless you're struggling with really severe mental disorders, then it's best to consult a mental health professional before going just for medical.
Anjuji, I hope you got your answer. Here, someone wants to know, how do healthcare workers deal with guilt of their family members being at risk for COVID-19, considering the nature of work?
Uh, this one really close to home, but I think I think a lot of us get into this profession. I know along the way our ideas change, but a lot of us get into this profession because we really want to do something. We want to make a difference, and you take that Hippocratic oath, and you want to help people. So, of course, there is that guilt of affecting your family, but you also want to be, this is our battle, this is personally a doctor's battle, and I feel like we want to be out there on the front lines and fighting against it. But about the guilt, I'll come back to the point that action is the antidote to all this anxiety and guilt. So I take measures when I make sure I'm coming into home. We wear some scrubs at work. Before I enter home, I make sure I take off all my, now my neighbors think I'm a crazy person who's taking their clothes off outside the door. But yeah, those are things you do. And the minute you come home, you rush into the bathroom, you take a shower. But of course, I'm a scientist and my level of exposure isn't as much as some of the emergency and the frontline workers. So as that's what a lot of governments are doing. They're putting up doctors in hotels and isolating. I personally know a friend who's in with respiratory medicine who hasn't seen her in 2 months now. So it is hard. You've got to do what you've got to do.
Yeah, there's nothing much you can do to help it.
No, and we all,
Because the whole world is relying on the medical healthcare people. It's obviously you are the only ones who can help us. So
I know,
there's no other option.
yeah.
Yeah. All right. So, Apra, just taking a quick recap, can you tell us the name of the techniques that you were suggesting, like grounding techniques,
Okay.
the CBT
So,
for overthinking? So, can you just like sum it up once so that people can search it whenever the session gets over? Once the session gets over.
take a good Google, do a good Google on something called grounding techniques, something called distraction techniques, and something called it's called PMR, progressive muscle relaxation. So these are the three
Okay.
sort of techniques to deal with anxiety in the moment. But also look at something called CBT, cognitive behavioral therapy. There's a lot of data out there, a lot of self-help material out there which will help you battle anxiety, and I will send you links, Karishma, to put out there.
All right. Thank you so much, Apra. I'm sure that in this 60-minute session, we could not obviously cover everything up. I have half my questions with me, which I could not take. But you've been so kind that you took out time out of your schedule to help us out. And yeah, so the timer is on. We have 1 minute and 56
Okay,
seconds remaining.
all right,
Yeah.
that's fun, and I was so anxious before this, but this has been tremendously fun, and
But it was so good.
let's
You're
do
a natural.
this. No, let's do more of this. All right, thank
Yes.
you everyone for coming in. Really appreciate
Yes.
it.
Thanks everyone for coming for the session. And yes, we do have such pretty doctors in reality. It's not that.
No, stop being my sister. You have collapsed, yeah. That's
But
all.
thank you so much again. All your tips were very helpful. And I'll share the links for all the kind of techniques that you've shared with us.
Thank you. And Karishma, you should tell other people about the sessions you've done with Dr. Varma and the obstetrician, Dr. Tripan.
Yes, we've also done other sessions with Dr. Nitin Verma, who's a leading pediatrician in Delhi. He was very, very helpful. He told us so much about how to take care of vaccinations and kids at home. And then we had a session with Harleen Bhasin, who's a dietitian. And she told us some really good methods of controlling weight and stuff like that. She was also very helpful. And then we had a previous session with Dr. Tripat Chaudhary. She's also a leading gynecologist in Delhi. And she told us and helped us so much with the information on how pregnant women should not be scared. So the whole idea of that session was to make pregnant women feel positive, and there was nothing really to worry about. And you are the doctor that we have today, and you're a good psychiatrist, and you've helped so much to all these people who've come here today.
Thank you. You've inspired me to be more vocal about this now, so I'll do that.
Yeah, someone here is saying my wife has a crush on Dr. AP.
Oh no. Go away.
All right. Thanks again, Apra. And
Bye.
it was a
Bye.
very good session. Thank you.
Bye.
Bye.